Massachusetts is blessed to have 351 different towns and cities, and each of those has its own Board of Health. So when you want to do something public policy-wise to help people have healthier behaviors, you really have to do it town by city.
Starting in the 1990s, there were local boards of health that were taking it upon themselves to try to protect the public's health from exposure to secondhand smoke.
And at the very beginning, when it was really more of a patchwork of communities moving at different paces.
The Supreme Judicial Court in Massachusetts ruled that the Barnstable Board of Health could indeed regulate secondhand smoke in indoor workplaces and public places. So that set the precedent for several other Cape towns that had not yet acted.
And so they enacted local regulations to restrict the use of tobacco or smoking tobacco in bars and restaurants.
Back around the early 2000s, several of the Cape towns were moving forward with smoke-free workplace regulations on the local level.
Actually moving with different components of regulations. We had a lot of communities that were concerned about the crossing the border and the level playing field, and they're going to leave my restaurant and go to the restaurant right down the street. It
raised the ire of the restaurant community, which had a legitimate fear in their minds that the regulations would negatively impact their business. And the same was true for the bar owners. The tobacco industry did a masterful job of feeding them with lots of information, negative information, and propaganda that led them to believe this.
So a lot of times we're going back to the same city or town 2 years later and updating their regulation. And eventually, you know, it dawned on even restaurant owners that, you know, I could live with a level playing field as long as everybody got treated the same, and that my restaurant was not treated differently from her bar. And so as long as everybody could be in the same town, then that solved that problem. Then the next problem was people would leave that town.
And through a meeting with John Auerbach and Harold Cox that they had with Cheryl, Sbarra, and DJ Wilson, Clean Air Works was born.
John and Harold, being the wonderful academics that they are, said, well, what we really think we need, there's strength in numbers, and they were right. There is strength in numbers, and we had up until that time really been working city by city, town by town. So what we suggested was that if they thought that this should be something bigger than city by city, town by town, then maybe they could take the lead and start maybe looking at doing something with Boston and Cambridge. And that was really the inception of Clean Air Works.
The beauty of Clean Air Works is that it was a regional approach. Yeah. It was a regional approach that had, I think it started with 12 communities, and 12. Then there were a number of others, and it went up to about 19 or so communities that joined the collaborative.
And they really were the leaders in bringing some of the Boston 5 communities into the conversation. And as a result of that, really, their efforts really are what triggered the whole of the state, but really that how do we brand something? How do we move forward collectively? And it was their concept and certainly their direction that led us and brought us all into the fold.
There were coalitions all across the Commonwealth, regional coalitions, where local boards of health would work together in their region to pass smoke-free workplace regulations.
By the end of 2001, the entire Cape and Islands region was completely smoke-free and was in fact the first geographic region in Massachusetts to be smoke-free.
It was a wonderful beginning of our interest in regionalization and what it means to regionalize, and we had posters that were made. There were policy templates that could be used by our individual communities. There were strategies that could be used by individual communities.
And so what we saw was in Western Mass, there was Clean Air Works West. We had Clean Air Works South, Clean Air Works North, and then the greater Boston area.
Until tobacco control, this wasn't really something that they exercised. And now here we were, outsiders, coming in to their local Board of Health meeting where they were used to looking at restaurant inspections and Title V issues, and we were asking them to use this plenary legal authority to do something that was very, very controversial. So, I really give them a lot of credit for actually doing this. I mean, it was not an easy thing for them to do.
We saw all of these local boards of health pass these regulations to protect public health from secondhand smoke exposure.
A lot of people understood that lung cancer is the #1 preventable cause of death, and that if people were exposed to secondhand smoke, that was a particularly bad thing to have going on in the workplace. So rather than saying, we're trying to control you smokers and send you outside, we said, we're trying to protect those that are helping you, serving you, when you go into restaurants and bars and other workplaces. And so it became an appropriate approach to changing public policy.
In 2003, Boston went smoke-free in their bars and restaurants. Mayor Menino was a really big supporter of going smoke-free, and John Auerbach was the commissioner at the time.
Part of what the mayor asked us to do before he was going to announce his support was he wanted us to approach the unions and see and get a read from them about whether they also agreed that this was in the interest of the workforce.
And then later on in 2004, the following year, we had Rachel Caprillion and Senator Fargo that really championed through the statewide workplace legislation.
This is the 10 o'clock news on Boston's WB56.
Advocates of a bill that would ban smoking in all workplaces and just about every enclosed space you can think of, including shopping malls and private offices in public buildings, held a pep rally of sorts at the State House, brimming with confidence that their moment of victory may be at hand. This state rep is co-sponsor of the sweeping legislation.
People ought to have the option when they want to go to a public place not to have their health compromised, and that's why it's high time that this bill be adopted.
The whole journey was that of affirmation, that we knew way back when that this was unlikely to change someone's restaurant-going habits, or that smokers would feel maligned, or whatever the case may be, but it would be better indoor air quality for everybody involved. And we saw that play out town by town by town, such that we hit a point of critical mass. Why not take it statewide? And I believe we were the 7th state at the time we passed it in 2004.
And Tobacco-Free Mass mobilized a coalition all across the Commonwealth, from nurses and local unions and parents and bartenders and hotel workers to really push for protection of employee health from exposure to secondhand smoke.
And it starts right down at the most local level, the local boards of health, the Massachusetts public health initiatives, the advocates, the nurses, the doctors, the school nurses, the parents. There are so many advocacy groups that we have to thank for this, because it didn't just happen in a vacuum.
Tobacco-free Mass has been essential to the success of the Massachusetts Tobacco Control Program. There's no question about it.
Here we are celebrating 10 years of smoke-free workplaces in the state of Massachusetts, and it's because of all of the work that the local boards of health did to really feed up to a statewide policy.